Ed Marx here. Welcome to Ed Talks. And we get to hang out with another just amazing person, Pam Landis. Pam, welcome to Ed Talks.
Hi there. It's great to be here with you.
Pam, you and I have known each other for many, many years. I've followed your career and it's amazing. You're still doing amazing things. We connect sometimes at conferences and we get to watch each other speak. And I'm like, dang, I'm always like taking notes and learning. And
Oh, that's so nice.
yeah, I just appreciate who you are. And you're such a giving person and salt of the earth. And so I'm super happy to have this conversation with you. Pam, you've been at Hackensack Meridian now for a few years. You were North Carolina Atrium prior to. Tell us a little bit about your career, like all the way from the beginning to where you are now.
Oh, wow. Thank you. Yeah, I'm really fortunate to be here at Hackensack Meridian Health. In fact, I live on the beach and I'm overlooking the water right now. So even though it's cold outside, it's still
Nice.
sunny and beautiful here in New Jersey. I started my career in a way that most people in healthcare didn't start. I graduated with a degree in journalism, and I worked for Gannett newspapers in the 1980s. And one day I was covering a story and I was struck by how during that coverage of the story, somebody said to me, "You really need to get the other side's opinion." And I was like, I really don't think their opinion's valid. I don't know if I'm like cut out to be a journalist. So I left journalism and actually went and worked in national political campaigns. And so I worked for a couple of progressive organizations like the National Abortion Rights Action League, the Women's Legal Defense Fund. They wrote the Family and Medical Leave Act. It was the first bill signed into law by President Clinton in 1993. And I also worked on Clinton Gore and other local campaigns. And when healthcare reform came in 1993 and 94 under Secretary Clinton, when she was the first lady, and it failed. And I was working on that as a communications professional in Washington, D.C. to try to get people to have more access to health insurance. And when it failed, I had a young son at the time and I was married. And I said, I can't stand Washington. It is a gutless, soulless town. They are not in touch with the real, I'm a Midwesterner. I grew up in Northeast Ohio. They are not in touch with my family and the concerns that my family and friends have and the struggles that they have every day. But I knew I loved healthcare and we were living in Baltimore at the time. And I said, well, I'm going to see if I could get a job at Johns Hopkins. So I left DC and I got a job working clinical PR at Johns Hopkins. And I got to see true magic. The physicians and the scientists that I did PR for, many of them were Nobel laureates. The basic science that was coming out of Johns Hopkins, the bedside research that was being done, the kind of things that were happening there. It was a privilege and an honor. And I got to see up close how healthcare is delivered and how hard it is to access. And I've had some of my own personal health struggles in the late 1980s. I spent 92 days inpatient. And I was lucky because I had great clinicians and great insurance. And I got great care and I lived. But I knew that this wasn't how it worked for everybody else. So one day, my boss leans out, screams out in the hallway, "We need to figure out this World Wide Web." And this is 1994, 95. I said, well, I'll do it. And the reason I said I'll do it was because the server for the department was in my cubicle. And so if there ever any problems, everybody would come to me, and this was my answer. "Everybody turn off your computer. We're going to reboot." And I would reboot the server. And so I said, yeah, I'll learn how to figure out this World Wide Web. And so I bought HTML for Dummies. I took a networking class, and I started kind of just digging in deep and building out Hopkins's first web presence in the 1990s. I left Baltimore. We moved to Detroit, and I landed at Henry Ford Health System, one of the finest health systems in the country. This was a place that day in and day out, they are serving the people of Metro Detroit in a really tough, competitive market, and they do it with such high quality. And I got to see how efficient delivery of care can be. One day I'm doing clinical PR there. The boss says, "We really need to figure out the World Wide Web." I said, "I'll do it. I've done it before." And I started their web department. Did that for several years, transitioned into IT. and then worked in IT. Remember the first ACO pioneer groups?
Yes,
Built out,
yes.
yeah, installed the EMRs and the revenue cycle systems for their pioneer ACO. And so we did all that kind of work. And then a guy, what was then Carolina's healthcare system, Craig Richardville, called me up and said, "What are you doing?" I'm like, "I don't know you. I'm not moving to the Carolinas." And my brother said, "Are you kidding? You have to move to the Carolinas. It's beautiful there." And I worked there for 8 years, building up their, what we called then their e-health department. And the same thing happened here in New Jersey. Somebody I had worked with at Henry Ford was here and called me up and said, "We need you to recreate what you're doing there and come here." And so I've been here for 5 years.
Yeah, that's an amazing journey and very opportunistic, right? You were the one that said, "Yes, I don't want to jump ahead because I want to ask you a couple questions on leadership." That's one right there. Someone asked for a volunteer, you raise your hand. You're like, "I'm all in. I'll pioneer this. I'll take
Yeah.
a chance, take a risk." So I know today that you have to serve a couple other peer organizations, and one is marketing, right, and one is sort of the tech. So how do you do that, right? Because a lot of people may find that to be awkward, but you seem to do it with amazing grace, and the outcomes, are the testimony to that. So share with us like how you work with marketing and tech and digital and bring it all together.
Yeah. I think that how my approach has been when my team's approach is, so I have a background in communications and marketing, but I also got my master's in health informatics and I've worked in an IT department. So I can see, so I bring a little bit of a credibility and I have a respect for the work that everybody does. So it's really, I look at it as a three-legged stool, bringing together the marketing communications, the technology people, and then the operations. And really I try to appeal to the better angels inside of them. A lot of times people will say, "Well, we could just do and turn on this one function inside something else." That's like, okay, yeah, we could check the box, but it doesn't deliver the great patient experience or clinician experience. And it oftentimes doesn't. So that's when I try to push them and say, be part of something bigger and
Yeah,
more innovative and something that is not checking a box, but something that you're really proud of. So I try to appeal to that part that's inside each of those folks, but also respect that there are some times when you have to just check the box and understand that that's okay. You live to fight another day. Because you're checking the box today and delivering something that, oh yeah, it does it. We could check the box on the most wired, survey. Does it do it consumer grade, how you envision it? No. Does it mean I'm done? No. And I always tell people we're not done. This
right.
is the start. We
Yeah,
start here and we keep going.
yeah. I love that. Pam, a lot of people look up to you. I do.
Oh,
And I know there's a lot of both males and females who look up to you. So I would love to hear from you. What are one or two things that you might share with our audience who maybe are earlier in their career and looking up saying, "I want to be like Pam. I want to be in a position like that. I want to be a leader like that." What are one or two things that you would share?
so I think one of it is kind of don't be afraid to volunteer.
Yeah.
Nobody says, there are not people who move forward in their careers. And if you look at them, they didn't move forward because they actually knew how to do the job right away from day one. They were willing to take the risk and they were willing to go for it and understand that they needed to learn through it and rely on others as they were learning and growing in that position. So I would say, when I started, I didn't know anything about the web. By the way, nobody did either. It was 1995. Nobody knew anything. Um, but I knew that it was okay for me to add to the tool belt
Yeah.
and add something to it. It wasn't going to be you're doing either or. You either have to do marketing or you have to do technology. You can do both. It doesn't have to be the either or. It can be an and there.
Yeah. I like that a lot. A harder question now that I was thinking about as you were sharing your story. You had some life experiences early on, and that has helped shape you. You're a very empathetic person. Um, and you believed in these great causes, and as a result, it comes through in your work. And one of the reasons that you've been so successful. What would you say to someone again, maybe earlier in their career, hasn't had a life situation where they were hospitalized for, 90 plus days or had something happen to them. How do they get a sense for empathy so that it comes through in all of their work that they do?
So when folks that are working in healthcare, every single one of them has had a family member call them up and say, "Can you help me? Can you get me in? I don't know what to do." And that's been actually the thing that I work on the most. Even though they might not have gone through my experiences, but they have other life experiences in their own families and their friend circles. And what I tell people is figure out what your cause is and your purpose. So for me, I think that healthcare still has a long way to go around providing easy access to care. That's my mantra. I'm not getting people in and helping them manage their care on their own. That's my thing. So find your thing. What is it in healthcare that makes why'd you choose healthcare? Because you could choose fintech or edtech. You could have gone a lot of ways, but you actually have the experience and the knowledge. Figure out what your value system is and what you really want to work on.
Yeah, that's powerful. That's really good because I get that question a lot. It's hard for me to answer, but that was great. Yeah, find your cause, find your purpose, and that'll help draw that empathy. And I think when you bring that empathy together with just good leadership practice, like what you were sharing, a magic happens.